Please feel free to write in the chat where you're joining from. Hi, Isha. Lovely to have you with us again.
Hi, Ritu. Good to see you.
Good to see you too. Austria, wow. And Ellen, hi. Hello, Ellie. So nice to have you from Barcelona. Bertrand from Switzerland and Julieta from Netherlands. Wow. We even have Korea. Gorgeous. In Kyung, hi. And Berna from Luxembourg. Ayadi from France. And Stefano from Italy. Hello, Isha. Again.
Ritu, do you want me to put up the slides?
I think so. Let's do that.
Hi, Sammy. Nice to see you again.
Hi, Sammy.
Hey, everyone.
That's the title of our session today. It's Understanding HTA. And I think we can start in another minute. Eleonora, is that okay?
Yeah, I think we can even start now. We have 50 people, so while people keep on flowing, you can start introducing the session.
Okay, let's do that. So welcome, everyone. Good evening from Singapore. And I will refrain from wishing you across the different time zones, but welcome to the fourth DEBRA International DEBRA Singapore PEOF Plus session. And today we are really excited about the session that I personally have been looking forward to, which is Understanding HTA. That's short for Health Technology Assessment, a very complex term that I had no clue about, or whether there's something called HTA. It sounded like someone in engineering would do, but now I know better that this is an integral part of healthcare. Whether it's called by this name or another, it is critical to healthcare decision-making in every jurisdiction or country. So could we just go back to the master slide one more time, please, Eleonora? So this session is focusing on how patients can shape healthcare decisions through contributing to HTA. Thank you. El, the next one. And for your convenience, we have a tool called Wordly. If English is not your first language, you will see this. Where would they find this, Eleonora? Do we have a link in the chat? Can we make that available in the chat?
A pop-up will appear on the
Okay.
screen shortly and
Now
in the chat as well.
Yep. So we have a pop-up now. Matt has just shared this pop-up on the right side of your screen. If you open Wordly, you will be able to get translation, simultaneous translation, real-time translation in the language of your choice. So if you want to hear this in Spanish, you can choose to receive the audio in Spanish, and whatever we say will get translated to Spanish, and so on and so forth for any language. So please choose the language you are most comfortable in. And if you need instructions, if you need help, please let us know in the chat, and we'll do our best to guide you. So I've opened my Wordly app, and it tells me translate to on the left side. Maybe I'll just share a screenshot of what I mean. It's really, I don't think I can share a PNG file. Eleonora, can you try?
It's on the screen.
Oh, there,
Ritu.
Matt has done it.
Here in the slide.
Okay, there we go. Yes, you can choose Spanish or you can choose any other language that you want. And hopefully you will be able to understand the contents of this webinar better that way. Any question, please type and we'll do our best to help you. So before we get started, may I request you to please keep your microphones on mute. and use the chat function while the webinar is going on to ask questions, comments, and feedback. But of course, we will give you opportunities in between to speak, and you can unmute yourself and answer. We are recording this session, and I really want to make this an interesting webinar. So it's really important for all of you to own this webinar and make it really what you want it to be. So I want to request you to be engaged in a conversation with all of us, particularly the speakers. So this is not a webinar where you will listen and learn, but we learn together, we share and learn together. That's the idea. Okay. So today's agenda, after the introduction, which I've just done, I will invite Fiona Pierce, and I'm going to introduce our speakers in just a moment. Fiona will be talking to us about what exactly is health technology assessment. She will sort of explain what's HTA, what the process is like, how decision-making is done, how patients and caregivers can play a role, how they can input their lived experiences and insights into HTA. And this will be followed by our second speaker, Anne, who is very keen to understand the practice of patient involvement in HTA in our region, Asia Pacific region. So Anne will ask you questions and invite your engagement on what kind of experiences you've had. And Anne will then share, explain a little bit about this Asia 360 study, which we're very excited about. She will, we'll let you get to this, to Anne, and she will explain what the study is and how it will be a valuable tool moving forward on capturing how patient experience can contribute to HTA processes. This will be followed by our third speaker, Eric, who will talk about challenges, opportunities, and engagement from his perspective from Taiwan. So Eric has been part of these processes for a long time, and we are very excited to hear about what he's done in the past. And we will conclude with a panel discussion where you will ask us questions, our speakers, and each other questions, and we will have hopefully a very robust chat on advancing patient engagement in aspects of healthcare, particularly in innovative medicine, given the huge technological advancements we are facing these days. How does HTA need to adapt and shift its evaluation or its frameworks in light of these technological advancements? So if I may go to the next slide, please, Eleonora. Yep. I just want to also remind you that we've had 3 sessions already of these webinar series. The first one was an introduction to patient engagement. The second was on evidence-based advocacy. And the third on advancing advocacy through multi-stakeholder collaboration. You will be able to access the links to this on the PEOF page, and Eleonora can also share this with you in the chat. So please continue to reflect on the previous sessions and other sessions that are available on the PEOF Plus website, and keep sharing with us what you'd like to hear so we can bring those topics to you in the future as well. Next, Eric. So today we're going to focus on a deeper understanding of HTA and consider what the basic tools are to engage in HTA processes within your own health jurisdictions, and talk about and recognize some of the existing barriers, future trends, and the value of patient engagement in HTA. So we do this our speakers will share a little more, and hopefully this will help us to meet our objectives. Next. So I'd like to introduce our speakers. I'm going to moderate the session. It's my singular honor to have such a stellar cast of speakers. We have with us Eric from Taiwan. Eric is the General Secretary of the Taiwan Young Patient Association. We also have with us Fiona, who is the senior advisor to the Agency for Care Effectiveness, which is the name for Singapore's HTA organization. And Fiona is also the HTA International Patient and Citizen Involvement Interest Group co-chair. I also have to add that Fiona is someone who I've learned so much from about HTA processes in Singapore and has been instrumental in meaningfully involving patients in HTA processes in Singapore, along with her amazing team. So it is a moment that I've looked forward to, and I'm very happy to be part of this today. And our final speaker is Anne. Anne joins us from Australia, and Anne is the Patient Voice Initiative CEO. She's also the HTA International Vice President and the HTA International Patient and Citizen Involvement Interest Group outgoing chair. So can I have the next slide, Eleonora? Thank you. I'd like to invite Fiona to start this session on which is Understanding Health Technology Assessment, the process and decision-making. Over to you, Fiona.
Many thanks, Ritu, for having me here today and for that very kind introduction, and also for moderating this very important session today, which I'm thrilled to be part of. For my session, I'm going to speak briefly about the principles of health technology assessment and the ways in which patients and their caregivers can be included in the process to strengthen healthcare decision-making and health policy development. And this will just help set the scene for the other presentations that we have from the other speakers this evening. So health technology assessment, or HTA, as we'll probably refer to it during these sessions today, is not all about technology like computers and smartphones. That's a misconception that a lot of people have when they hear this term. The technology that we are referring to in HTA is a medical intervention, such as medicines, vaccines, or surgical procedures like a hip replacement, or even a medical device like a scan or a finger prick test for blood glucose monitoring. You can see some of those here on this slides. So governments cannot financially support every new health technology that comes onto the market due to limited healthcare budgets and resources. And also, new technologies are not always better than the existing ones that are available, and they're usually more expensive. So whenever a new health technology is introduced, it might be necessary to stop or reduce funding something else that's already being used. And to ensure that these funding decisions are fair and consistent and also supported by reliable evidence, we use health technology assessment. So this method essentially collates and analyzes information about the clinical, social, economical, and often ethical issues as well related to the use of the health technology so that we can understand its benefits, the harms as well, and the costs compared to alternative options or the existing standard of care that's already being used in clinical practice. So put simply, HTA balances the cost of the health technology against the benefits it brings to patient care and helps us identify which patients are most likely to benefit if the health technology is funded. Can I have the next slide, please? Thank you very much. So the methods and processes of HTA can differ in each country, but the type of evidence that informs the assessment usually includes a literature search of the clinical and economic evidence that's available, cost information for the health technology that's being evaluated, but also for the alternatives that it's being compared to, as well as expert opinions from patients and clinicians about local clinical practice and the lived experiences of medical conditions and the treatments. Sometimes economic models are also developed for cost effectiveness analyses and budget impact simulations to estimate the long-term benefits and costs of a health technology when it's used in the local population. So all of this information is then collated into what is known as an HTA report. And then it's this report, as well as some other things, that is used to inform funding recommendations for the technologies. Next slide, please. Thank you very much. There are different ways that patients can be included in the HTA process. And this is really important because involving patients improves the relevance of the assessment. Patients have knowledge, perspectives, and experiences that are unique, and it contributes essential evidence to this process. Their input also improves the legitimacy of the resulting funding decisions from the HTA, because those most affected by the HTA decisions have an opportunity to participate in the process, and then this contributes to the transparency, accountability, and credibility of those decisions that have been made. Now, there's different questions that patients might be asked in an HTA, but typically there are a core set of questions that are important to understand. And I've got them here on the slide for you here, asking questions like how the conditions affect the patient or their carers' daily lives and their quality of life, the experiences that they have with their current treatments, and their expectations for new treatments. And sometimes the patients might already be on the treatment that's being evaluated, and sometimes they won't be. But even if they don't know about the new treatment under evaluation, they can still provide really useful insights about what they would expect in terms of the benefits that they would like to see from this new treatment compared to what they're already having. And all of this information is collated and included into the HTA report to present to those decision-making committees. May I have the next slide, please? Thanks so much. So the HTA is actually only part of the process. Once the evidence is collated, it needs to be appraised by the decision-making committee, and there's different bodies in each country, and they review all of the evidence and they deliberate the quality of the evidence and use it to make their funding decisions. The criteria used does vary across jurisdictions depending on healthcare priorities, but there's typically core criteria that underpin the decisions. So in this slide, I'm showing the criteria used in Singapore, which is largely aligned with other mature HTA systems, such as in Australia and the UK. They typically look at these criteria sequentially, so starting with the clinical need of patients, then going on to look at how well the treatment works and whether it's safe, then the value for money, which are the cost effectiveness and economic considerations, and finally budget impact, so looking at affordability for the government and also for the patients who might have out-of-pocket expenditure as well. In addition to these core criteria, sorry, can we just go back to that previous slide? On a case-by-case basis, other factors such as social, ethical, and cultural considerations might also be necessary, and these help to inform the decision-makers' value judgments. And in most countries where there are HTA processes in place, the decision-making process is deliberative, so there's not apart from the standard criteria that's being used, there is flexibility in decision-making to look at other factors until consensus is then reached to make a final decision. And that flexibility is really important, particularly in examples where technologies may have positive evidence underpinning the assessment, or there are factors that are relevant to the local context that need to be considered as well. The next slide, please. Thank you very much. So just in the interest of time, I want to finish off by highlighting the impact of patient input and how it has been really important in Singapore over the last couple of years as well, informing HTAs. The process for patient input was only introduced a few years ago, but over the last couple of years, we're seeing almost 80% of the HTAs having input. And I just wanted to highlight generically some of the impact this has been. So I know this is an interactive slide, so if we could just show some of the cells, please. We've seen that the patient evidence has helped decision makers identify unmet needs and the treatment preferences of patients in the local context, but also helped to explain the benefits and disadvantages of their current treatments and what they would like to see in a new treatment that's being assessed. Thank you very much. It's also important to fill knowledge gaps and address uncertainties in the scientific evidence, and also determine if the outcomes that were captured in the clinical trials or included as assumptions in economic models are relevant to the local patients. And lastly, patient input helps identify if there's any issues affecting a patient's ability to use or access treatments. And they've also helped the decision makers really understand how specific medical conditions have affected them, their carers and their families and their relationships and their ability to work, for example. So these are all things that are very context specific and are not in the scientific evidence base. So it's a really crucial part of information that helps enrich the HTA. Next slide, please. Thanks very much. So I'm just going to stop there, and we'd like to have an interactive session now to hear more from you. I know Ritu has asked some of you already to put in the chat where you're from, but we are going to have as the first poll a question asking about where you're from and if you know of any HTA processes in your country. And that's an open-ended question, so feel free to write as much as you'd like. We're then going to go on to ask about how familiar you are with the HTA process. And that's a multiple choice selection there. So you can choose if you're very familiar, somewhat familiar, or not very familiar at all. And then on the next slide, we have two other questions that you'll see in the poll. The first one is, have you ever been involved in an HTA process in your country? And there's different options as to the level of involvement as well, and whether you've been involved as a patient advocate or maybe as a healthcare professional or as an HTA practitioner or policymaker. Or if you haven't been involved, whether you're interested to do so or if you're not really sure how to do that. And lastly, we're going to ask a question about if you've had experience involving patients in HTA or healthcare decision-making before. And if you've done this, if it's been regularly or just occasionally, or if you haven't but you'd like to, we'd love to hear from you. So all 4 questions are going to come up in the poll. You should be able to see that on your slide now. You just need to scroll down before you press end poll so that you can answer all of your questions. And we'll start to see the answers coming up on the screen. I'm going to be handing over to Anne as well, who'll be going through some of these answers with you before she starts her presentation.
Thank you, Fiona. I can see the polls slowly filling out there. I can see that we've got 77 online, which is fantastic. So it's going to be interesting, I think, to see the mix. I'm a bit of a fiend for a poll. I love watching who we've got. And we're going to also, in addition to this poll in a minute, we're going to open up some other opportunities. Oh, I just lost my poll. Oh dear, that's not good. Just bear with me while I find my poll again. I was trying to make, oh good, I found it. Hopefully you haven't lost your polls. So I can see the numbers still going in, and you can see the variety immediately that we've got in the audience. And just in a minute after we've done these polls, we're going to create some opportunities so that you can share your experience. You can raise your hand and share on camera if you like, or you can take part in the chat, or you can continue to use some of these polls. And in all the polls we're using in these sessions, we've got multiple questions coming in. Now, I imagine when we get the end poll, I can see the variety of countries, but already from Ritu's introduction, and thank you, Ritu, for asking me along today. It's so terrific to be a part of this. I can see that we're in Asia Pacific, but we're spreading out all over the globe, and we can see that, you know, people are joining us in the very early hours in North America. So there's a real diversity here. And one of the things we know about health technology assessment around the world is, as Fiona said, it looks a little bit different everywhere you go. And that's because health systems are different, right? You know, they have a different relationship to government. Some governments provide universal health coverage. Some have mixed systems of private and public. Some are all privately funded. Some are insurance-led. And all of this influences the way the system is set up. And then we're all culturally different, and we're a very diverse community down here in Asia Pacific. And so our health systems reflect who we are as societies as well. And that's why health technology assessment does look a bit different wherever we go. Now, I think that poll steadied out, so I'm going to look at some of those results. We've got a great mixture there of familiarity with health technology assessment. And thanks so much to those of you who are joining who've never come near this topic before. Fiona did such a great job explaining it. But I always think when you hear this term health technology assessment and then find out, oh, okay, this is really about trying to make a fair way of making decisions about how we spend our budgets to get the best health outcomes for our population. It seems a little less daunting. So it's great to have those who are new to you and great to have those with experience and those building your knowledge as well. And I can see that we have some patient advocates, we have some health professionals, and then we have quite a split. I'm thinking that a slight majority who hasn't had experience getting involved. And so that's great. We will have people who be able to share their experiences of involvement, and also for those of you who don't know anything about what that looks like, I hope this will be useful for you. And finally, have you had experience involving patients in HTA and healthcare decision making? You can see there again that similar split. So we might stop sharing that one. And I'll try and find my way back to the screen. I don't know how I did that. Eleonora, you will interrupt me if I'm breaking the equipment.
Maybe what we can do is while you find your way back to the screen, I see Ken wanted to share and pick up your invitation. And in the meantime, we're going to launch the second poll.
Oh, thank you. Thank you. I can see the hand up there. And was it Sharon? Sorry, while I get my screens in order. Ken, sorry, it's Ken with his hands. Ken, I'd love to hear your experience.
Thank you, Anne, for your instruction. Very clear. First, I want to apologize because I lost my input screen in the middle of the process. So I raised my hand to speak rather than type because it's difficult for me, a little bit tricky for me. So can I spend 1 to 2 minutes?
I would welcome that, and I fully understand the problem with losing screens.
Yeah. I'm from Hong Kong, and Hong Kong, to the best of my knowledge, doesn't have a formal HTA body nor HTA process. The way I learn about Hong Kong HTA is I have seen some documents within the health authorities using HTA as tool to justify the purchase, the capital expenditure of purchasing medical equipment like PET scan or MRI, but we never have using HTA as a drug evaluation process to evaluate to assess the cost effectiveness of a novel treatment. And even for assessing the or justifying the introduction of new equipment like PET scan or MRI, patients and the public were not informed. We don't know what's going on, but it just happened. We happened to, through the internet, get some document which maybe left behind unintentionally. That's why, so summarize, Hong Kong doesn't have formal HTA body or process for involving the public and the patient at large. And the reason to join this is I learned something fundamental about HTA, like the cost effectiveness analysis using some sort of quantitative method, and arrived at per country, for example, the willingness to pay by the government or the healthcare system, but how to use this willingness to pay to justify a new drug, and especially we are talking about not one disease. Even in one disease, we have several new treatments. So how do we tackle this situation? And also across the board, in any country, we can have many fatal disease which require new treatment. So it's a M multiplied by N evaluation in the whole healthcare system, this make it very complicated. That's why I wish to learn more about how to practice HTA, especially the cost effectiveness, economic assessment, and at the end of the day, how do we make the wise decision for the benefits of patients? Thank you.
Oh, thank you, Ken. And there's so many things that come to mind. It's being suggested to me that in Hong Kong, HTA is done by the hospital authority, and all around the world, people make decisions about what they fund in different ways. And sometimes it's not health technology assessment. Sometimes they use another decision mechanism. And I think if you're from a region... Oh, sorry, can I just ask for people to turn their microphones off? And then if you want to take part in the conversation, please put your hand up. But wherever you live, a process is happening where decisions are being made about what we will fund and what we'll invest in for our health system. And as Fiona pointed out, how do we know it's relevant to really what patients are experiencing and what they would prioritize? So even if you haven't got health technology assessment in your system, I hope there's things you can learn about how you can use patient knowledge in these processes so that it is a more patient-focused system. Also, we can share reports between our countries as well, which I think is valuable. Now, I'm watching the time, so I'm actually going to go to our next poll, which again, we're going to hit you with 4 questions because we love polls. So here are our next 4 questions for you to have a look at. The first one is, what has been the biggest challenge in engaging patients in HTA processes? Now, I'm going to read out the answers there just to help anyone who's getting these on Wordly. So there is lack of awareness or understanding of HTA, health technology assessment, among patients. Patients are not included early enough in decision making. Limited access to policymakers and decision makers. Insufficient training, resources for patients to contribute effectively. Maybe there's language or communication barriers, or a lack of funding or support for patient involvement. So we'd love to see your thoughts on that question. And I'm just going to go on and read you the next question too, which is, we want to know really, what do you actually think? Is patient involvement in health technology assessment important? Why? How? And we've given you some suggestions here, but of course, if these answers don't reflect your views, you can put it in the chat. We'd love to see your views. So patients bring real life experiences that improve decision making. It ensures healthcare decisions reflect patients' needs and preferences. It increases transparency and fairness in healthcare policies. Patient insights help prioritize the most meaningful treatments. It contributes to better research and evidence for decision making. And then finally, I can see already people are going on that 3rd question. Thanks for scrolling down to there. Is there a risk in involving patients in health technology assessment evaluations? And this is worth talking about too. Something can be very valuable, but we need to think about what risks we have and how would we mitigate them. So patients may not have enough technical knowledge to contribute. It might slow down decision-making processes. There's a risk of patient input being influenced by industry or personal bias. I suppose I often think that the personal bias of a patient is actually their experience, which we can learn from, but I'm interested in your views. There's a lack of clear frameworks on how patients should be involved, or no concerns. Patient involvement is essential and should be increased. Other things that sometimes people talk about is how do we support patients in these processes? You know, people are already actively managing their condition or caring for someone with a condition. How do we make sure that it's a positive experience for patients in being able to bring their knowledge and feel respected and heard in these systems? So great. I can see we've divided all over with those answers. It's interesting. No one's pulled out language or communication barriers. I think that's quite interesting. It's not been picked up tonight. But I can see, you know, that lack of awareness or understanding of HTA among patients. And that might even just be about what the space of your patient knowledge is. But that can be a big challenge. And we can see there's, is patient involvement important? A really strong support for patient involvement there, saying it ensures healthcare decisions, reflects patients' needs and preferences. And also bringing that real life experience. Yes, what happens in clinical trials is incredibly important for bringing us robust data. But what do these treatments look like? What do these tests look like? What do they mean to patients in the real world away from the trial environment? And what do patients really seek from treatments? And then if I look down at the risks, I can see really thoughtful response where we're looking and we're thinking about all the things we've got to be mindful about there. So I'm going to end that poll and I'm going to check then to see if anyone's got their hand up or put anything in the chat while I've been flicking in my screens. Oh, thank you, Angie. I'm just going to share Angie's chat because I think that will enable those on Wordly to see what she's said. Thanks, Angie. At 5 a.m. in Chicago. My perspective, patients don't have a big influence on health technology assessment. Data is used once. Oh, I'm being scrolled away. Sorry, Angie, while I'm reading your comment. Just bear with me.
Would you like me to help,
Yes.
Anne?
I am getting there, but if I don't get there quickly, can you see it, Ritu?
I can. Angie's question, I
Oh,
can.
thank you. Thank
No
you. Could
problem.
you read it out? I thought it was a great comment.
Absolutely. So Angie is saying that patients don't have a big influence on how HTA data is used once it's created. So we have an obligation to pull their voice through into the process so they are adequately represented. So Angie, I guess this is an opinion more than a question, right? That it's an obligation to ensure that patients are represented because they cannot much influence how HTA data is used once it's created. Is that what you're trying to say?
Yeah, it's more of a just a comment around, you know, once this data is created and it's out there, there's little influence that a patient may have. I mean, some advocacy groups and others can help kind of elevate that data, but it's harder to actually pull through that voice, and they may not be heard. And there may be things that in that data that contradict their patient experience. So it's really important for that to be that counter voice to be heard through that data. So doing it early and involving them often is really important.
Thank you.
Oh, thanks, Angie. And I can see that Juliet picks up that comment as well about, you know, sometimes by the time something gets to health technology assessment, so many decisions have already been made. And I also note the comment about transparency. We hear that a lot around the world, that people actually get engaged with health technology assessment and they share their knowledge. And then it's not clear to them from the feedback they get. Was it considered with the other evidence? How was it balanced with other sorts of evidence? Was what we did useful? So these are really useful points that people are bringing forward there. Now, I'm mindful of the time, and Lisa, Ritu, may I take Lisa before I quickly flip to the next slide? Oh,
Please.
thank you. Welcome, Lisa.
We also have a question in the chat in Spanish that maybe we can translate for you so that you can
Yes.
address. So after
Thank
Lisa, we
you.
can go there.
Thanks very
Thank
much,
you.
Anne. I'm interested in the ultimate outcome of integrating the patient perspective. So are reviews faster? Are they quantitatively better aligned with patient metrics? So we have that data for clinical trials when we integrate the patient perspective, but I haven't seen any of that data for patient perspectives in HTA, and I'm wondering if you could help shed some light on that.
Yeah, that's a great question. There've been a number of papers published where people have evaluated what is it that they learnt from the patient involvement. You know, one of the things about health technology assessment, as Fiona alluded to, is that you're balancing clinical effectiveness knowledge, you're balancing cost effectiveness knowledge, particularly in the non-medicines assessments. You're looking at organizational issues, and then you're bringing the patient knowledge, and they work together. So we often identify areas where key learnings were made. And sometimes patient involvement would seem not to particularly change the outcome. So, you know, there is, and in many systems, there's a strong emphasis on the cost effectiveness. And it may be that the patient involvement highlights benefits that had not been understood, and that keeps the discussion about what cost effectiveness really is. So it really varies. One of the things that can happen, and I'm what I want to say is it sort of depends what the assessment is. You know, one of the areas can be sometimes something might seem not clinically significant in the clinical data, and sometimes it's not significant. But sometimes, by hearing about the relevance to patients, something that didn't seem very significant can be very significant in the real world. And if I give you a quick example, we often had tests around mobility that were the outcomes. So, for example, someone might be able to walk a certain distance, and to a committee, sometimes those measurements or times did not seem really very impactful. But by putting patient knowledge into the health technology assessments, we were able to understand actually to be able to walk that distance means someone can actually leave the house and get in a taxi and have some independence, or someone can take themselves and look after their own care in terms of getting dressed or going to the bathroom. So sometimes this is that sort of getting behind the numbers and illuminating it to see, what does this really mean? What's this data really about for patients?
Thank you, Anne.
Now,
and we have one more great point that Eleonora has translated. Eleonora, may I read that aloud?
For sure.
Yeah. So it was the observation was from Mario, and I think it's a great one. I'm reading out Eleonora's translation of Mario's comment. It is true that patients, that is clients suffering from the disease, may have little knowledge and significant bias, but don't professionals have them as well? Aren't the professionals influenced by government interests or their own? And I really like this point because I'd never thought about the input given by government officials or by clinicians or researchers as being biased.
and Richie, don't we all have our bias? And I
Mhm.
always think, when I'm talking to a patient about a particular treatment or condition or test, I want to know, what is it like for you? Their bias is the point, really. And so sometimes we're not as clear about the bias of others. And actually, it's really important to have that on the table, because for a patient, the bias is part of the reason you're there, because you know it in a way that the rest of us don't know it.
So, Anne, can I interpret that as bias is not negative necessarily? It's just, it's important to disclose what your perspective is, why it's that way, who you're representing, and that makes it more robust, not less.
Absolutely, absolutely. It's about being open and transparent about where you're coming from. And, you know, if I'm doing something for my organization in Australia, we, for example, have some pharmaceutical sponsorship, and I will let people know that. But if someone wants to talk to me about my own particular conditions, I need to let them know, actually, that's a personal experience for me, or actually that's something, that's that group. You know, what's the basis for the claim you're making? Well, often for a patient, it's their lived experience.
Absolutely. Thank you so much. Dorota has some comments. Funding for patient involvement is also important, including budget for training, So to let patients act as equal partners, yes, absolutely important to upskill patients and patient advocates so they can make informed and useful contributions. So I think let's keep the comments coming. I will allow Anne to conclude, and then we'll invite Eric to take over.
Excellent. I just wanted to talk quickly, if we can go to the next slide. I just wanted to flag with you a project that's going on. I hope this won't send you to sleep. I'll be brief, but I'm excited about this project because as we've talked about it, you know, health technology assessment is different around the world, and the opportunities for patients to get involved is different around the world. And back in 2023, we had a lovely experience of a workshop where we had people from 9 countries in Asia Pacific. And we very rapidly, we called them snapshots. We very rapidly shared our experiences of what does health technology assessment look like in our area, and what how does patient occur if it occurs, or how does community get involved. And from that, we really thought that even though we're an incredibly diverse region across Asia Pacific, actually there's things that are really valuable for us to share between us. And so we came up with the idea of making a living document that would map what is the process for getting involved in each country, if there is a process, or what is the process for making decisions about health technologies in each country. So whichever stakeholder you are, whether you're a patient organization, industry, you're an HTA body yourself, you can see not only what's going on in your country, but you can have a look and see what's going on in others. And we wanted to do this in a way that wasn't just about the document at the end. So the way we're looking at doing this, and we've got this multi-stakeholder working group that grew out of the meeting in 2023. We want to do this in a way where we can have focus groups and surveys to get this information about what's occurring, but also workshops, because we want to strengthen our networks across Asia Pacific so that we can know each other better and share practice between us and give each other a bit of moral support as well. And so if you go to the next slide, I should say the project is being led by HTA Patient and Citizens Interest Group, and I will put the link to that body in the chat, and there's a whole lot of resources there. But if you're interested, if you're in Asia Pacific, and I'm sorry for those of you outside the region, we actually think once we get this going for Asia Pacific, we expect other regions will probably be very interested in doing something similar. But if you're in Asia Pacific and you want to find out a bit more about this project or get involved, please follow that QR code there. And if you miss the QR code, if you follow the link to the Patient and Citizens Involvement Group in the chat, you'll be able to get in contact with us. So we're doing a range of workshops this year. The first one is going to be at HTA Asia Link in August, and we're going to talk about what's happening and what do people believe about HTA, and that's a living resource that we hope will really support people around the region to get involved, but also to foster great practice. And so with that, I would like to hand over to someone who's actually been involved in that work since we met back in Adelaide in 2023, and now is incredibly involved in health technology assessment in Taiwan. Eric, I'd hand over to you now.
Thank you. And hi, everyone. I'm Eric from Taiwan Young Patient Association, and I'm one of the patient representatives in Taiwan National Health Insurance Pharmaceutical Benefit and Reimbursement Scheme Committee, and PBRS in short. So what is PBRS? Let me make a quick introduction. And next slide, please. So this is the reimbursement application process in Taiwan. So once the case is applied by a pharmaceutical company, our National Health Insurance Agency will make the case, and then they will order the CDHTA team to make a HTA report, and then they will hand over this report to the expert consulting committee. There will be a lot of physicians sitting in this committee, and then will decide whether this medicine is can meet the needs of the patients, or they will evaluate whether the clinical trials or the data are valuable enough for our patients. And then at the same time, we patient representatives, we can share our opinions onto the patient opinion sharing platform. And then our opinions will be integrated into the HTA report after the report is reviewed by expert consulting committee. So then the final report of HTA will be handed over into PBRS, and where patient representatives are sitting in. In this PBRS committee, there are a lot of stakeholders from physicians, from governments, from HTA, from CDE HTA, and from patients, and even from some of the representatives, consumer representatives. Then in this committee, we will make the appraisal decision. We will discuss whether this medicine to be reimbursed by our national health insurance and how much it should be reimbursed. And then we will set up some conditions to see if under what condition this medicine can be reimbursed. Then after we make the final decision, the National Health Insurance Agency will go, they will discuss the MEA and maybe PVA or maybe some other budget control program with the pharmaceutical company. And after they come with an agreement, the National Health Insurance Agency will announce the final decision. So this is the process of how a new drug to be reimbursed in our national health insurance. But there are two notes to share with you. Next slide, please. In this expert consulting committee, there is no patient representative sitting in, and the patient's opinions are only listed in HTA reports for reference, but not calculated into the assessments. So in Taiwan process, we have the platform, we have the channel to share our voice, but it's hardly discussed by other stakeholders. So maybe our voices, our impact is limited. So the way we try to raise our voice, and next slide, please. So we have 4 ways to raise our voice. The first thing is to do some patient research. We will invite patients to share their experience. We will do some like survey and to ask them to fill in the survey. Then we will come out with a patient research report, and then we will invite experts to consult with our report. And then we will file a formal report to our government. And sometimes we will invite legislators to hold public hearings. So we did held a lot of public hearings in the Legislative Yuan last year. And then we will invite media, journalists to report what we are asking for. So then we can raise our patient's voice to our government, and they will probably hear our voice, and then we can make the decision makers to hear more about patient's opinion. And okay, next slide, please. So as I mentioned before, there are some challenges and opportunities in advocating for patients' voice. I think from patients groups perspective, I think most of the patient groups, we don't have enough expertise to discuss with decision makers, and we don't have enough attention from the society, because most of the people in Taiwan, maybe they are healthy, maybe they don't really care about the healthcare issues. So without enough attention, patients' voice often will be neglected by the government, and that's why we have to do media pitch. We have to hold press conference, and maybe we have to hold some public hearings. And then the third thing is there is lack of the protection of the law. We don't have formal seats or formal rights under the protection of the law. So we can only fight for ourselves, and the law does not protect our rights to raise our voice in the government's process. So what can we do next? Next slide, please. So I think the next step to raise patients' voices in Taiwan, the first thing is education, definitely. I hope all of our patients groups can have enough expertise to have the skills to discuss with our government, to discuss with the experts. I think in most of the countries, physicians or the governments, they don't think patients' voice is professional enough to be discussed. And that's why we have to learn how to become more professional in the discussion. And then the second thing is legislation. Of course, I know some of the countries, they have law to protect the rights of patients to raise their voice. So maybe we will fight for the formal seats in more committees in our national health insurance. And then the third thing is to reinvent the process. I hope patients' voice I hope patients can involve in earlier of the process, not only I hope patient voice not only listed in HTA reports. Maybe we can start from scaling scoping the HTA research, and maybe we can sit into the consulting committee, and maybe we can join in more into the whole process. So I think this is all my experience in Taiwan and some of my point of view to raise patients' voices. And I also have four questions for the audience, right? Next slide, please. So these are the polls. And okay, the first question is, how do you think patient advocacy can have the greatest impact on HTA decisions? Okay, so the first one is improving awareness of patients' needs among decision makers. The second one is ensuring access to innovative treatments through HTA. And the third one is encouraging transparency and fairness in reimbursement decisions. The fourth one is strengthening collaboration between patients, policymakers, and industry. Okay, the second question is, what is the most effective way to increase patient engagement in HTA decision making? And we have the option training and capacity building for patients, creating formal patient roles in HTA committees, strengthening collaboration between patient groups and HTA bodies, ensuring transparent decision-making process, and providing financial and logistical support for patient participation. Next slide, please. The third question is, what is the best barrier preventing patients from advocating for their voices in reimbursement decision like Taiwan's process? The first option is lack of knowledge about HTA and reimbursement processes, difficulty in accessing decision makers or participating in discussions, limited on the organizational or financial support for patient groups. Concerns about whether patient voices will be taken seriously, and lack of public awareness on how HTA impacts treatment access. And the final question is, if you could improve one thing about patient involvement in HTA in your country, what would it be? And this is a open-ended question. You can type in your wishes. I think, should we invite Ken or other participants to raise their questions while we're waiting for audience to fill in the pool?
Oh, yes, Eric, can I ask you a question?
Yes, sure.
Yeah. Thank you for your presentation. One of your slides show that in Taiwan, patients are not represented in the expert consultative committee or something like that.
Yes.
So how Taiwan patients can be involved in the HTA process, that I'm not quite sure. But I have one fundamental question for you and the other speakers, because from Eric and from the other speakers, I sense that one fundamental issues you are talking about is how to engage patients during the HTA process. But from my personal experience, maybe Hong Kong is quite different from the rest of the world. The number one question is really fundamental question is how to engage from patient's point of view, how patient advocate can engage the official HTA body or process to get our foot in the door and to engage the process so that patient opinions and input are included in the HTA process. So back to you, Eric. What is the, I forgot, sorry, how Taiwan patient get involved in the HTA process? Thank you.
Okay, so the very first thing I've done in Taiwan in our organization is to start research of breast cancer patients. We invite like 50 breast cancer patients to do the qualitative research with us, and then we look into their patient's journey to see what are the unmet medical needs, and then we come up with a report. Then we take this report to discuss with our government. So I think that the first thing from a patient group, we can do our research in the disease we are focusing on, and then we can take this report to discuss with our government. Then we fight for this opportunity to get into HTA like 3 to 5 years. And before we really get into this process, we did a lot of patient research.
Okay.
So maybe this experience can answer your question.
Yeah. So actually, the Taiwan HTA process does have a component or a framework that patient will be included. So what kind of input? I'm not sure. What kind of input you say you do a research, patient do a research and then come up with a report and then talk to a government. Is this process a part of the HTA process, or is it just an external process to get patient the foot in the door, and I mean knock at the HTA body's door to say, hey, we are ready, we want to discuss with you, something like that? Is it a formal process to get in?
Right. Yes, what I've just shared with you is the external process, and what is how we fight for seats into the HTA process. But there is a process, there is a channel that patients can share their voice to the HTA body, is that we have a patient opinion sharing platform. But I don't think that channel is clear enough for patients to share their opinion, because the platform asks patients to share their experience of using new medicines or innovative treatments. But in Taiwan, before the NHI reimbursed those treatment or medicines, most of the people doesn't have the ability to use those treatments out of pocket. So we have limited experience. Then we can't provide enough experience or enough data to the HTA body. So then these data will be not valuable enough for them to evaluate the value of the new treatment or new drug. So what we do is try to do the research of the current unmet needs of the patients, but instead of the new treatment experience.
Thank you, Eric. I think that's great, great interaction happening here. I just want to invite Sammy to ask his question, if I may. Sammy?
Hi, can you hear me?
Yes.
Yes.
So I also from Taiwan, so I think Eric and he's my friend. So I think I can share a little more bit, respond to the Ken's question. Because in Taiwan, there really HTA body is a formal body in our reimbursement process. And also, just like Eric say, we have a new drug opinion sharing platform. It's operated by our government. But like our foundation, we also collect patients' opinion. No matter what he used new drug or not, they can provide their opinions, including caregiver. So we will organize this opinion and submit to the government, to the HTA, and before the reimbursement decision making, the final decision making, the HTA body, they will have a pre-meeting with us, because they know we have submit many opinion, no matter they have experience with new drugs. So they will have a pre-meeting with us. It's formal pre-meeting. So they will listen to our opinions. This is interesting because in the pre-meeting, we will find often they will lost some opinion. For example, we submit 5 drugs.
Sorry, Sammy. I apologize, Sammy, for interrupting you, but can I ask you to wrap up? Yeah, we have another Sammy who has a question.
Yeah, sorry. So I just want to answer Ken's question. That's yes. We do have formal engaged process. Yes.
Thank you so much. Can I invite Sammy Tai to ask his question or her question? Sammy, you have your hand up.
I think this is the same Sammy. I think this is the same Sammy.
Oh,
yes. I just want to give a little. No question.
Got it. Because you have. All right. So I really would like to go to a very interesting point that Mary raised. Mary, do you want to share a little bit about what you are, what that was about the need to change this mentality? And I know we had like a panel discussion, but I think there are so many interesting points being raised on the chat that I would love to address some of those rather than go to the questions that we had for our panelists. So over to you, Mary, and lovely to have you with us.
Hi, hello Ritu, hello speakers. My name is Mary Wang, I'm from Rare Diseases International. And yeah, so I made that comment because I think often as patient advocates, we feel like we need to be able to speak the same language, because when you're in a committee situation, a lot of big words are being used and lots of the structure and flows, and so you don't feel you have the capacity to speak. But in the end, the patients, they know the best of their condition, and so I just feel like you don't need to necessarily be able to speak in the same formal way, and can provide your experience, and that should be respected. So that was my point that in chat.
Thank you. We have a similar comment from Kim Soon, who has put on the chat. And I think there were a lot of comments on what exactly makes for expertise. And I think who was that who was talking about, I can't remember now, but there were a lot of comments on what exactly is an expert, who should give input. But can I invite all of you here to ask any question you may have to our speakers? It's wonderful. I think this is the most interactive session we've had. Ken, I've seen your hand. Can I just collect the questions, and then I'll make sure that everybody has an opportunity. Could I ask our audience to feel free to either raise a hand, that might be best, or put on the chat the questions they may have. Anyone? No, Julieta had very, very nice comments as well on we are not using the same language or words. We are not taken seriously. Okay, so while we're waiting for all of you to ask questions, and Ken, I know that you do have a question. May I take the opportunity to ask just a couple of questions, because I've been itching to ask those questions for a while now. One of my questions is, I was wondering if Fiona, you would like to jump in with a little bit of an example from Singapore on how we've used the process. I'm really proud of what we're doing in terms of patient engagement for HTA in Singapore, and I think this is super valuable to share. So if I may invite Fiona to say a bit about the processes you have introduced with the CEE team in Singapore. Over to you.
Thanks so much, Ritu. This is a fantastic opportunity just to share what we've been doing over the last couple of years. I think most HTA agencies have a similar experience to Singapore in the sense that patient involvement is an integral part, but what we find is that it's largely under-resourced. So in Singapore, the HTA agency has about 100 staff that work there across all different disciplines. A lot of them are technical staff, but there are 4 people who are dedicated specifically to working in patient involvement. And this is key. And a lot of HTA agencies don't have a dedicated team. But this is why it has worked, I think, quite well in Singapore. These staff have networked, identified all relevant patient organisations in Singapore, and put a lot of time and effort into explaining the process, how they can become involved. And also, even before that, an important step, designing the process of involvement with those patient organisations. So that co-design process is really important, because if an agency sets up something and then expects patients to follow it, but they don't understand how to, or it doesn't meet their needs, then it's actually a redundant process. So a lot of time was spent working with the organisations about how they'd like to be involved and what support they would need in order to do so. So there's been a lot of education, resource and training to get them up to speed. And I can see there's heaps of comments in the chat about the importance of training, support, what's available out there. And yes, there is a lot, but often you find you will need something that's context specific as well. There are a lot of cultural barriers in the Asia Pacific region that you often have to overcome. One thing we find in Singapore, and I'm sure this is quite similar to some of the other countries, particularly our neighbours, there's a hierarchical structure in terms of decision making. The government is always seen as a central power, and the public and patients in particular don't feel empowered to be able to speak up and to raise their voice against an entity like the government. So giving them the confidence and the opportunity to be able to do so took a lot of time. Something that's very important, and I think it's been critical to the success of the program and the ongoing engagement that we get from patients that come back time and time again to input into our HTAs and our processes, is the feedback loop that the team implemented. So once patients take time to put in their input through the survey, through questions that they're asked, it's then used by the team to inform the HTA and presented to the decision-making committees. And in many countries, patients never hear about how that information was used. They just hear down the track whether a product is funded or not. But in Singapore, they specifically go back to the patient organizations or the individuals, if it's one patient who's provided a response, to explain what the decision was and what was most meaningful to those decision makers from the submission that they received from the patients. And this is really important because patients have so much evidence that they can provide, but sometimes it might not be specific enough to help with the decision making. So if they understand what was most relevant for that decision, next time they put in a submission, they can spend their time focusing on those areas as well. So they don't have to spend too much time on other things that might not be meaningful in that context. We've found now that, as I mentioned before, that probably over 80% of HTAs now have input. There was a question before about how patients can be involved and how you can identify patients if there's not a patient organisation. And we do see that in Singapore, particularly around rarer diseases as well, and some of the rarer cancers. There may not be a relevant patient organisation that you can work with to get input. In those situations, we typically rely on clinicians to identify patients, and then, or the nurses or other allied health professionals who can send out a survey or help collate responses as well. In Singapore, we allow individual patients to provide a response, or patient organisations can do a collated response on behalf of their members and submit it in. We also have different formats for submission. So there's a really detailed survey that they can complete, or if they just want to share certain aspects of their medical condition or their journey or their views on treatments, we've got a patient journey form, so they can submit that evidence as well. And some of the surveys are also translated into Chinese now as well. So we're starting to provide things in other languages where we're able to make it more accessible as well. So there's some of the things that have been implemented. We've only been doing this for the last 3 years. It's a relatively new work stream, but it seems to be really impactful so far, and I'm very proud to be part of this team. Thanks, Ritu.
Thanks, Fiona. This is brilliant. I have to say that I'm one of the patients representing rare diseases who was invited to engage. And I confess that I'm a skeptical patient, and I am always wary of any initiative because I find engagement very tokenistic and very, very not meaningful at all in Asia. And so I was really skeptical when I was asked by the ACE team to sort of support and give input. And it has been an incredibly eye-opening experience. We've undergone training. I don't like to use that word, but we've been given information that equipped us to participate. We've been respected. Our input has been valued. We've received feedback on why a certain product that we requested to be evaluated was not successful. And that feedback will help us to reapply for a product, and sort of that input will shape our subsequent reapplication. So I think it's a really great process, and I wonder if ACE might want to help with creating some kind of practice, an example, such as through a publication, because we have a question from Carlene who says, what does best practice patient involvement in HTA look like? I think Singapore's done really well. And of course, I'm just maybe terribly biased, but we've heard today that bias is okay. So do we have some examples? And can Fiona and Anne and the PCIG interest group contribute to some of these gaps that we've identified?
Absolutely. And that's what the Asia 360 study is all about. So as Anne mentioned before, we're looking across the region. We've identified probably about 14 jurisdictions now in the region that already have established HTA processes, and they may or may not have patient involvement already. And this study will really draw out the best practices that we're seeing in the region, but also highlight examples for other jurisdictions that might not have implemented anything yet if they want to see if it fits in their context. There have been similar studies that have been done in Europe and in other parts of the world as well. So we're aware of best practices maybe in the UK or in Australia, but there is a paucity of published evidence in our region specifically. So that's what this study will hopefully address. And over the next 12 months, Anne and I and many other people are going to be surveying and working with all the different stakeholders to find out more information. And already you're sharing some really great insights in this chat. So I'm very excited to see where this project goes.
So
Just
can
sort
we
of
hope?
add to, oh, sorry.
Yes. Can we
Oh,
hope
yeah, I
that
was just
we
going.
can address the gap? Go ahead, please.
Yeah, exactly. And if you pop on the Patient and Citizens Involvement Group website, what you'll see there is actually there are values and quality standards. Now, that work was led by Dr. Karen Facey more than a decade ago, but they still hold quite true. Now, we revisit them all the time, and we'll do this as part of Asia Pacific 360. But what I think is really interesting is what I was hearing in the Singapore practice that speaks to some of those value and quality standards. And, you know, one of the ones on that list that we so rarely hear people achieving is that feedback one. And we think it's absolutely essential for relationship building, for capacity building, and for confidence. Like, why would you give your time to something if someone's not giving you feedback on it? So it's really lovely to see that. We also think about some things like an explicit goal. Sometimes you're asked to be involved in something, and sometimes you might need to be able to speak the same language as the other people on the group because of the goal. And sometimes you might not need to speak their language at all. You just need to bring your experience. So sometimes, you know, are we explicit about why we're doing it? Co-designed processes, we're seeing so much more satisfaction since we stopped imposing practices. So it's great to see Singapore do that. And then this thing about being transparent about what information is coming into the HTA system so that people can target their approach, and also what happened with the evidence that was used. And I think the final thing is about being flexible. Sometimes we can learn from people who may be trained in this area and know quite a lot about health technology assessment. But, you know, when we're planning our cities and we get people involved, we don't expect them to talk town planning and engineering. We actually ask them about what it is they value. And I think we could do more of that in HTA, not always asking people to be experts in us, but us learning to listen better so that we can learn from their expertise.
Thanks, Anne. I have like a whole page of questions that I was writing when you guys were speaking, but unfortunately we don't have the time. So any final comments before I hand over to Eleonora to wrap up? And I definitely think we should have another session. Any final thoughts, Eric? No? Anne, Fiona, anything at all?
Thank you.
Comments? Okay, I know that we had a question from Ken, but Ken, can we please save that for another time? And yeah, is that okay, Ken? We will continue a communication loop through email or another platform. I hope that's okay because we have 6 minutes left, and yeah, I have loads of questions, but I'm going to have to hold back on that. Eleonora, is there? Yeah. Okay, Mario, you have a question in Spanish. Eleonora, do you want to help me translate this?
Sorry, is it correct that when we talk about this diseases, we focus on efficiency rather than efficacy of solutions? Like, correct as in, is it just that efficiency comes above efficacy of solutions? And I guess it's a bit more of a rhetorical question or a provocative question that Marius is leaving there to let us think through this.
Okay, so I will definitely, Eleonora, is it okay if we share an email on chat that our participants who didn't get an opportunity to send questions or get responses can continue to send questions to us? Do you think we can share some?
Maybe they can email In the meantime, if they have anything, we can include a form for them to keep on populating questions in the follow-up email, which will be sent by next week together with the slides and the recording of the session. And we will make sure that your questions go to Fiona and Eric, and that in the final output of the session, around a month from now, you can receive a full answer for that. But in the meantime, feel free to send your emails my way, and I'll do my best to forward them to the right speaker.
Thank you. And of course, you are welcome to get in touch with me as well. And I'd like to invite our speakers to please share their email if they would like to receive questions. Otherwise, absolutely no obligation. So I have 4 minutes left on this session. I'd like to thank everyone for joining. This has been the best of the 4 sessions, I must confess, because of the amazing interaction, your questions and your comments. And clearly this demonstrates that we have a huge need to address aspects around HTA in healthcare. Guido, thank you so much for your comment earlier. I read it briefly, but I will go back to it and read it later. Thank you so much for joining us from Vietnam and for your input. Eleonora, do we have a QR code for the feedback?
It just popped on everybody's screen. So it's one final survey.
Survey. Oh yeah, I'm seeing it now. I would love to hear what you thought about this. Please do participate, give us your feedback and tell us what you'd like us to share further on, what topics you'd like to hear about, etc. Thank you, Fiona, and thank you, Anne and Eric. All the emails are in. It was wonderful to have you guys. Thank you for your kind comments and thank you so much for your participation. It is wonderful to see this community growing and strengthening. And hopefully our webinars will have an impact on your healthcare engagement in your countries and on the outcomes to your advantage in the future.
Maybe, Rito, if I can add one small thing, if there is anyone that may be interested, our next PEOF session will be in Japanese and but open to anybody that may want to attend. It will happen on March 10th. And you can expect a few of our Japanese partners to discuss around the recent update of the Helsinki Declaration, which basically makes it systematic to consider patients as partners in research. And so we will try to reflect on what may be the potential impact of the revision of the Helsinki Declaration in Japan, but also overall globally. So join us, invite your Japanese friends and colleagues to join, and my dear friend and colleague Clementine, who's been supporting us throughout the session, has just shared also the link of this session in the chat.
Thank you so much. So I wish all of you good night, good morning, and a huge thanks to Fiona for staying until, what's the time now? I guess 11:30?
Yep, it's all right.
Thank you so much. Thank you, Eric. Thank you, Anne. And thank you all of you for joining. Good night and see you again at the next session.
Thank you. Bye-bye.
Bye.
Thank you.
Thank you.